Hello friends, welcome to the show Talk with Your Doc. Colorectal cancer incidence is increasing day by day. Every day in my practice I see quite a few positive biopsies for colorectal cancer. After the skin cancer, the colorectal cancer is the third most common type of cancer detected in North America. In man, 1 in 23 men will develop colorectal cancer, while in 1 in 23 women will develop colorectal cancer. In 2016, there are 50,000 deaths reported due to colorectal cancer in America. So we can see that colorectal cancer is quite a significant disease in our society, and the incidence is growing up and up. With me today is Dr. Harshad Telang. He is a surgeon at Thunder Bay Regional Health Science Center, and today we are going to talk about the colorectal cancer disease. Welcome, Dr. Telang. Thank you for coming.
Thank you very much
really
for having me.
Really appreciate your time. We see a lot of patients with the colorectal cancer, and what do you think, what are the causes possibly leading to increase in the incidence?
We see a fair number in certain populations, as well as probably dietary habits also have a significant factor. More recent work is showing that red meats such as beef, lamb, etc. increase the risk of developing colon cancer.
So what do you think, what happens when we eat red meat or beef diet? What are the changes in our body which leads to the colorectal cancer?
I'm not 100% sure, but it has to do something with the breakdown products of the meat in
some
the colon.
Sort of chemicals which are produced with the breakdown of the meat can lead to colorectal.
Yes.
So do you think that meat consumption reduction will reduce the incidence of colorectal cancer?
I think it will definitely help, yes, absolutely.
Yeah. And what are the other factors other than the diet? So meat diet, so what can we replace it with? Like if we don't want to eat meat, then...
Well, everybody's worried about protein.
Protein, yes.
Without eating meat, but there's many vegetarian options that supply adequate protein, so
right.
That's not really a big concern. So I think a well-rounded diet, and I don't think you have to cut meat out completely, but minimize it as much as possible.
Especially red meat or beef diet, which is
exactly.
increasing the colorectal cancer.
Yes.
So more fruits, more green vegetables
absolutely.
will be definitely, should be more component of the diet.
Yes, more roughage, more dietary fiber.
Right.
Has been shown to potentially be protective against colorectal cancer as well.
Right, right. What about the family history of colorectal cancer? If my parents have a colorectal cancer or somebody, what are the chances of me getting the cancer?
So the risks are increased with first degree relatives. So if your father or mother or brother or sister, or even if your children have had colorectal cancer, then your risk is increased. And it's also increased if there are multiple extended members. Mm-hmm. So if your father or mother didn't have colorectal cancer, but your mother's sister and her brother and her grandmother, or her mother, your grandmother had colorectal cancer, then your risk of colorectal cancer also is increased.
So what transmits this? Like what are the genes or what are the factors which leads to the increase in the colorectal cancer incidence in the family? Is there some sort of genes being transmitted for the colorectal cancer?
There's definitely a genetic component to it. Mm-hmm. I personally don't know exactly what genes are involved with the familial part, but the genetics clinic at the health unit would get involved when there's multiple family members with colorectal cancer and be able to advise patients on their risk.
Right. So as I understand, if our family history, first degree family has a colorectal cancer, then I should take a precaution to reduce the incidence of colorectal cancer in me. So how do I do that?
So if you have a first degree relative who's been diagnosed with colorectal cancer, then the recommendation is that all of their first degree relatives should have colonoscopies at the very latest 10 years before their age of diagnosis. So for example, if somebody was diagnosed with colorectal cancer at age 60, then all of their brothers, sisters, and children should have colonoscopies by the age of 50, if possible.
10 years before the diagnosis of...
Yes, or sooner, but 10 years at the latest.
And then how often I have to get it done then?
So at this point, the recommendation is every 5 years.
Or every 5 years if I have a family history?
Yes, as long as there's nothing found. If there's something found, then it's different, and then it changes.
Changes, right. So family history, the diet, what are other possible risk factors you think is leading to colorectal cancer disease?
Some heritage also has a factor in it. For example, African American populations are known to have an increased incidence of colorectal cancer, as well as certain Jewish populations, namely the Ashkenazi Jews have increased risk of colorectal cancer. Other factors would be patients who have other more immunosuppressive type of illnesses, such as long-term problems with diabetes or other diseases that affect their immune system. Can also not cause it, but may help
predispose.
And make it worse.
Right. How about smoking? Is smoking related with colorectal cancer?
There's some association, absolutely, between smoking.
Alcohol.
Yes, excess
so
alcohol
reduction in the
consumption
smoking will also reduce.
Definitely.
The incidence, right?
Yes.
Is there any geographic distribution? Like I was practicing in India pathology, I found that incidence of colorectal cancer is low in the Asian continent as compared to the America. What do you think? Is it your experience or?
Well, I personally have never practiced in India, so I can't say firsthand of working in Asia, but we know from studies that there's a higher incidence of colorectal cancer in North American populations as compared to African populations. And that is thought to be, for the greater part, related to their diet and low
lifestyle.
meat and very high fiber diet.
Right. So when the people from low incidence move to high incidence, their diet changes, the lifestyle changes, and that leads to the increase in the incidence of colorectal cancer.
Absolutely. East Asian patients, or not patients, but people who move to North America have then developed similar higher incidence of colorectal cancer.
Because they adapt the lifestyle and the diet related, which leads to increase in the incidence of cancer.
Yes.
Right. Thank you so much for sharing with us. We'll take a short break and we'll come back to you after the break. Thank you.